I went to the emergency room roughly 2 weeks ago, and it was because I had severe abdominal pain, so they ended up telling me I had a cyst in my ovaries. But tell me why I just got my bill today, and it is $15,472. Mind you, I waited in that emergency room for 5 hours, and all they did was one blood test, one urine sample, and I guess an x-ray of my stomach. But what? $15,000?
Let's be real. You're not just a patient in America's healthcare system. You are a recurring revenue stream. And if you don't believe me, I want you to ask Goldman Sachs. In 2018, they straight up asked, is curing patients a sustainable business model? And to be clear, they weren't asking for moral clarity. They were asking for shareholder guidance. Because in our system, curing people is bad for business. Managing you indefinitely, now that's profitable. So today we're going deep. We're talking about how the US healthcare system got hijacked, how it became less about keeping you alive and more about keeping you paying, and how even the most selfless act, like donating a kidney, can turn into a liability in their eyes. This isn't fear-mongering. This is the business of American sickness. Let's get into it. Let's start with the Goldman Sachs report. Back in 2018, analysts posed a question that still echoes. Is curing patients a sustainable business model? Now imagine that line coming from your doctor. Oh, we could cure you, but then who's going to pay for the follow-ups, right? Because that's the game. Take hepatitis C. We have a cure, one-time treatment, over 90% success, lives saved. But Wall Street didn't celebrate. They panicked because once cured, those patients, they stopped generating revenue. No more pills, no more doctor visits, no more lab work, no more profits. In Goldman's own words, and I quote, while this proposition carries tremendous value for patients and society, it could represent a challenge for genome medicine developers looking for sustained cash flow. Translation, we don't like healthy customers. They leave too soon. Sound familiar? It's the same model you see with gym memberships, streaming services, and credit cards. Only this time, it's not Peacock, it's your pancreas. We've turned healthcare into a subscription economy. You don't get cured, you get managed. High blood pressure. Well, here's a lifetime of medicine. Diabetes. Here's a billing cycle for every insulin vial. Your mental health? We'll see you next week forever. And if you miss a payment, good luck accessing your next dose. This isn't care. It's captivity with a copay. Now let's talk about the article that sent me spiraling and researching. The New York Times just ran a piece on living organ donors. People who voluntarily give up their kidney or part of their liver to save another human being's life. You would think they would be treated like heroes. But in our system, they are liabilities. Here's the quick reality. Many donors are stuck with medical bills. Some are denied life insurance or health coverage afterwards, and they receive little to no follow-up care. One woman donated a kidney to her father and ended up with a $1,800 out-of-pocket cost after her family raised money. And when she later applied for life insurance, she was denied for being high risk. She saved a life, and the system treated her like she asked for a handout. But here's the worst part. There's a massive shortage of organs in this country. We need more donors, but instead of protecting the ones who step up, we punish them. And why? Because it's not profitable to care for someone who's already done the transaction. There's no margin left. It's just risk. Before I go any further, I want to be honest with you again. I work in finance. I built models for healthcare systems, analyzed revenue streams, and seen how the money moves. Hospitals, clinics, PE-backed roll-ups for specialty practices. And at first, I was impressed. The numbers were efficient, clean, scalable, until I started asking the wrong questions. Why do ER visits get upcoded to generate higher reimbursements? Why are hospital systems buying up local practices only to charge more for the exact same care? Why do nonprofit hospitals have billion-dollar endowments while patients go bankrupt over a $5,000 bill? I realized something I couldn't unsee. We don't have a healthcare system. We have a healthcare business. And like every business, it has a core KPI. Keep the customer paying. Let's zoom out. The US spends more per capita on healthcare than any other country in the world. Over $4.5 trillion a year. Yet we have lower life expectancy, higher maternal mortality, and worse chronic disease outcomes than dozens of countries that spend less than half. So where does money go? Middlemen, pharmacy benefit managers who mark up drugs like ticket scalpers. We got the hospital systems that charge $100,000 for procedures that cost $10,000 abroad. insurance companies that deny coverage by default and profit off every delay. And then we have private equity that buys up practices, slashes costs, and bills more. Then they exit for a 10x profit. Every step of care is optimized, not for health, but for margin. And you're the product being squeezed. Let me ask you something uncomfortable. If the system cured you, would you still be profitable? Because I want you to think about it. A diabetic patient generates $15,000 to $20,000 per year for the system. A cancer patient, up to $150,000 per year. A dialysis patient, over $90,000 annually. And the government foots most of the bill. But a healthy person, zero revenue. The incentive is clear. Treat, don't cure. Manage, don't eliminate. Prolong, don't resolve. Sick is sticky, and nothing gets billed more efficiently than a disease that never quite goes away. You would think innovation would save us, but even disruption gets co-opted. Take the rise of digital health apps, concierge medicine, or telehealth. They promise personalization, transparency, even affordability. But behind the curtain, most are venture capital backed. Many sell your health data, and then some prioritize growth over outcomes. It's just a new interface for the same business model, subscription-based sick care. Even your fitness tracker, it feeds into the system. Because what's better than a sick customer? A healthy one who's scared they'll get sick and willing to pay to prevent it. And let's not give insurance companies a pass. They're not your safety net. They are your gatekeeper. Premiums go up, but coverage shrinks. Deductibles stretch into the 5 figures. And when you finally need care, they ask for a pre-authorization, then deny the claim, then send you to collections. This isn't rare, this is policy. United Health made $22 billion in profit last year. How? By betting that you'll give up before they do. Because every denied claim is money they get to keep. Now here's where things get psychological. We've been conditioned to believe it's our fault. Didn't eat healthy enough, didn't exercise, didn't take charge of our health. But how do you take charge of a system designed to confuse you? Hospitals can't tell you prices up front. Doctors, they get bonuses for prescribing certain drugs. Insurance networks, they charge every year, and billing codes are complex on purpose. This isn't about personal responsibility. It's about structural design, and it's working exactly as intended. Let's do the math. Big Pharma, $1 trillion valuations. Health insurers, record profits during a global health crisis. Hospital CEOs, millions in bonuses, while nurses, they get laid off. And PE firms, quietly buying up dermatology clinics and even hospice care. This isn't a conspiracy, it's capitalism. Unregulated, unchecked, and uninterested in your well-being. Because the moment your health became a spreadsheet, you became a line item. You might be thinking, okay, I'll just go holistic. I'll eat better. I'll avoid the system. Yeah, good luck with that. You still need insurance or you'll be bankrupt by a broken arm. You still need prescriptions or you'll have to pay $600 out of pocket. You still live in a country where employers tether your benefits to your paycheck. It's not a system you use. It's one you live inside of. You don't escape it, you survive it. This video isn't meant to scare you. It's meant to wake you up because the healthcare system isn't broken. It's exactly working the way that it's designed to. Profitable, scalable, relentless. And if you're not actively questioning it, you're probably funding it. If this video hit you, I want you to drop a comment. Have you ever been denied coverage, ever been overbilled, or felt like a working invoice instead of a human? I want us to talk about it. And if you want more breakdowns like this, like real talk on how systems profit from our pain, hit that subscribe button. We got more coming in the works, like why private equity is quietly buying your doctor. So I want you to stay smart and stay healthy and stay aware, because the biggest threat to your health might be the system that claims to care for it. Till next time, peace.